Welcome back, everybody. You should know this. The end of Massachusetts open enrollment for health coverage ends January 23rd.
And joining us tonight to talk about all of this is Audrey Gasteyer, who's Chief of Policy and Strategy at the Health Connector, which is the group that links individuals with their health care coverage. So, Audrey, thanks so much for coming in.
Thank you for having me.
Very important information here because people only have about a week left, right? What is open enrollment?
So open enrollment is the time of year when individuals who don't get coverage through their employer or in another way can come and shop for health insurance through the Health Connector. They can shop from a wide array of health insurance companies and products, get enrolled in that coverage. If somebody's already covered through us, it's the time of year when they can come and update their information or maybe switch plans if they're interested in doing that.
Healthcare is obviously such a big expense in Americans' lives in particular. How are premiums looking this year and deductibles? What's the cost looking like this year versus years past?
Absolutely. So we've had actually very stable premiums coming into 2019, so that's great news for people shopping for health insurance. And Massachusetts actually has the lowest average premiums of any exchange in the country. So people who want to come and check out their options can know that there's really affordable options available to them. And on top of that, most people who come and shop at the Health Connector can qualify for additional help paying for their premiums. We have many people enrolled in a program called Connector Care that has particularly low premiums and even more affordable cost sharing, either no or low copays and no deductibles.
And of course, the biggest question in most people's minds is, what if I suddenly lose my job, I run out of COBRA, what am I going to do for coverage? So what are their options?
So the Health Connector is a great place for people to think of as a resource when something like a job loss happens, whether they might move here from other state or experience another kind of life change. So open enrollment is the time of year when anybody can come and shop for coverage, explore their options, but in the rest of the year, if you lose your job or lose coverage through your employer, you can qualify for something called a special enrollment period and come and check out your options, and you're able to get into coverage at any time when that happens. And that's true for getting married or having a baby or another life change like that.
And the Mass Health Connector isn't just for individuals, it's for businesses as well that want to provide health coverage to their employees. What is the new option that you're giving to small businesses this year with their coverage?
That's right. So about a year ago, the Health Connector launched something called Health Connector for Business, and it's a new program for small businesses in the Commonwealth that have fewer than 50 workers, and they can come and shop for coverage options from all the leading carriers in Massachusetts and shop for high-value, affordable healthcare options. And there's some new features like new savings opportunities for businesses that they can check out that are only available at the Health Connector, and some new flexible options where employers can actually allow for their employees to shop from a lot of different insurance companies and offer flexible products that can be really helpful for a small business.
So important because you hear from so many small business owners how expensive it is.
It's their biggest expense.
To provide coverage for all of their employees. So you are Obamacare for Massachusetts.
That's right.
People might hear things in the news and wonder if it applies to us. Talk about this ruling about Obamacare in Texas, and would that ruling have any effect on what happens here?
So the ruling on the case that is in Texas right now and is now going up to an appeals court, the Fifth Circuit of Appeals, would have substantial impacts across the country on the Affordable Care Act, including Massachusetts. But that being said, Massachusetts has a lot of its own rules and laws in place that protect things like protections for people with pre-existing conditions. And as you know, Massachusetts had its own health reform law. There could still be impacts if something like that were to be ruled in a particular way, including money for the Commonwealth to help support these types of programs.
So keep your eye on it.
Exactly. So it's something we're watching very, very closely.
Well, the Republicans in Congress also repealed the individual mandate, which is a part of Obamacare, and they've reduced the open enrollment at the federal level. Have you noticed any impact in Massachusetts on the cost of premiums or anything like that because of what's going on at the federal level?
We've been successful at navigating those types of changes and making sure we're protecting coverage here in the Commonwealth for people. But there has been some confusion about things like the individual mandate penalty. At the federal level, they did get rid of those penalties for people who are not carrying coverage. But in Massachusetts, we still have that requirement that people carry coverage that meets state standards. So that's still in play. And that's been in place since 2007.
So still face a tax penalty here if you don't have it.
That's exactly right.
Well, Audrey Gasteyer, thanks so much for coming in to explain all of this. So open enrollment ends next Wednesday. We'll have the link to the website on cbsboston.com.
Thank you so much for coming in. It was nice to meet you.
Thank you so much for having me.
Let's go.